That's right. That's right.
That's right. I like the gorilla.
My green screen.
Excellent. Oh, I thought it was an actual painting on your wall.
No, I haven't gotten that far yet. That's why I look like all wavy, and I'm actually more tan than you. How about that?
I know that's a first, huh?
Well, I just got back from spray tanning. Everyone knows I spray tan, and it's like the bronzer they put on you. When you shower the next day, it comes off, but you look ridiculous when you leave.
Nice.
Anyway, yay! Welcome back, everybody. So exciting. Hi, Joey. We got some people hopping on. All right. Well, I'll just get into it. So I like the scruff, by the way. It's a good look. Not
Yeah,
enough doctors do that.
I
So
know.
because they're not all created equal.
Little segue.
Yeah, little segue. So you guys, this has actually been a topic that comes up a lot. And a recent seminar that I did, I had about 4 questions regarding this, which is pretty interesting, considering the transition with telemedicine now during the COVID era, I guess. And basically, a lot of people want to understand what is the difference between a doctor like Dr. Eric or someone who specializes in hormone optimization versus their general practitioner, and the difference between someone who is cash based like Eric or insurance based, and what exactly those services look like. Because quite often, and this happens a lot, where somebody will ask, well, why can't my doctor handle these tests, or why can't my doctor interpret these tests? And the truth is, they might have a capability to interpret some of it, but it's not their specialty. And it's very similar to the fitness industry, where there's trainers who specialize in certain things, similar to if you go into the surgical industry with medicine, you wouldn't go to your cardiologist for something that your gynecologist would want to cover. So a lot of people get kind of confused as to, all right, well, what are the questions I'm supposed to ask, and what should I expect? Because they don't know who to go to. And a lot of the times they think endocrinologist, because endocrinologists do some hormone things, or gynecologists because they deal with some sex hormones. But when it comes to actually optimizing and understanding what an athlete needs, because if you're training and all that stuff, you want to be optimal. You don't want to be normal or in range or considered just like everybody else. So Eric, can you give us a breakdown of what the experience is when somebody goes to someone like you, who is cash based and focuses strictly on hormone replacement and obviously walks the walk, versus a general practitioner or somebody that takes insurance that is like a routine visit?
Yeah, basically, yeah, you kind of hit it on the head, and I get that question asked a lot too. And it comes down to, especially now in this era of personalized medicine, even a lot of the clinicians are drilling down too. The way I explain is that it's kind of like most people understand, as you mentioned about surgery. Most people understand to go to their family doctor or whatever. I say, look, if you've got a heart problem, you go see the cardiologist. If you have a hot gallbladder, you're going to go see a surgeon. If you broke your ankle, you're going to go see the bone doctor, the orthopedist. So these guys and gals specialized in that particular area. If medicine is very specialized and sub-segmentalized, just like the fitness industry, the nutrition industry, there's specialists everywhere. Your general practitioner, they do a great job, God love them, but they're overwhelmed. Unfortunately, it's a conversation for another day, but business, unfortunately, politics and the business of economics and big pharma's involvement has kind of put a clamp on that industry. Even when I was in the emergency room, family practice docs, I mean, they're capitated, and they only have a very, very limited amount of time spent with patients. They got to keep moving. They can't sit down and spend an hour with a patient going through the questions that I'm going to ask them. So they'll start the basics, and if it's something that's specialized, they're going to punt. And I did that even in the ER. I mean, I knew a lot about a lot of things, but I know when I need to call the surgeon or the urologist or whatever. Same with their family practitioner, they're going to send them to a dermatologist or a hematologist to work up something, and et cetera, et cetera. So same thing here. They don't have time to work up these complex medical, complex hormonal issues. And a lot of times it's not just, oh, he just needs testosterone. Well, maybe, but it's usually more than that. That's why there's so many these milk clinics that just do testosterone. And they all end up seeing me because they get screwed up and I have to fix them. So there's a lot more to it. It's way more complex than just reading a bunch of studies and saying you're an expert. So basically that's how I explain it to patients. You want to see a specialist for your issue. So maybe you have mold issue. You're going to see a functional medicine practitioner who all they do is mold or autoimmune. So with hormone optimization, especially as you mentioned, the fitness industry, people that are athletic. So if you want someone who does that or sees that a lot. So, that's kind of what I do. That's my niche. That's why I'm the fitness physician. So I work with a lot of people who that's my kind of my avatar, right? Is people that are, still want to hit the gym. They want to go to the track. They want to fight, do MMA or, bodybuilding or whatever that may be and stay active and keep their body coming along. So, your general practitioner may know the basics, even endocrinology. Unfortunately, they do a few things okay, but a lot of them, they kind of like last night, right? We had a mutual client has been bounced off their endocrinologist, and it's like, I can't believe they said that. It's just one of those things. I'm not going to bash anyone. Everyone's doing the best that they can. We all screw up, make mistakes. I do it all the time. But even the endocrinologists, they're not used to dealing with the very detailed hormonal optimization space, especially in the fitness industry. So that's how I explain it to patients. And you definitely want to go to someone who walks the walk, talks the talk, and knows what they're doing, not just someone who just did a weekend course somewhere, read a few articles, now they're a hormone expert. It's way more complex than that.
Yeah, it's interesting because there's situations similar to what we've experienced with mutual clients that happens really often where clients will say, okay, well, my doctor is telling me this, and my doctor doesn't agree with what the hormone specialist is agreeing with. And it's like nobody communicates and is on the same page. And I think that's one of like the benefits of you and I working together is, if I'm communicating something to a client to tell their doctor, it comes across much differently from that's my trainer because that's what they refer to me as, versus communicating it with you because you have the credentials. This is what you do all day. Quite often, when people seek out help from a GP or somebody else, these doctors are not, their whole practice is not made up of people looking to optimize their hormones, whereas yours pretty much is, because they're held to the amount of patients that they have to see to meet a certain quota. And they're dealing with, people who come in with weird stomach pain or a weird bruise or something, or a routine physical, whereas you're strictly allowed to spend as much time as you want with somebody to go over their entire history and get an understanding of what exactly they need on all levels. How often do you find that you have to communicate with other practitioners of clients, and does that ever go smoothly, or is it always like an egotistical thing? And it's the same thing like in the fitness world. And I mean, I know what I don't know, and I've had clients where I've been like, listen, this is over my pay grade. I know a coach who completely specializes, like something like PCOS. I've referred people out because I'm not going to take someone's money if I can't help them. So how much of that exists in the medical world?
Unfortunately, quite a bit. I personally haven't had to deal with it too much, but I'm starting to see that more and more. One of my mentors, Neil Rouzier, he's a well-known hormone expert. He teaches all the WorldLink medical courses, one of which I just did this last weekend for the second time because it's that good. He mentions this all the time. One of his other partners has, they actually have I think one of them, but he tells his patients, say, look, I'm going to tell you to do the XYZ. And if you go, and like you said, they'll go to see their other doctor. Oh, my doctor says that hormones cause cancer, or my doctor doesn't like this because hormones do this, and something that's just completely wrong. And he just says, well, why'd you come see me? Well, you're the hormone expert. Well, here's what I want you to do. Well, yeah, but my doctor said. Well, okay, it's him or me. Either we can work together and work, as a team, which it should be. But unfortunately, a lot of physicians are great at working together, but unfortunately, a lot of them aren't. Just because I don't know if it's territorial, if it's pride, if it's ego, it's ignorance. I don't know. I don't know why. Because I like to play in the same box with other people. I don't know why other people don't, but a lot of people don't, unfortunately. Then he tells the patient, say, look, okay, well then let's go do what your doctor says, get off your hormones. Well, then I'm going to feel bad. Well, that's your choice. Well, then take the hormones. Yeah, but my doctor said. So he just tells him, look, if you come to me and you say my doctor said or my doctor doesn't think, then we're done. I'm not seeing it anymore. And that's how he is. A lot of clinicians do that. I haven't had to draw the line yet, but I'm sure that will happen at some point. So I just, I tell the patient, say, look, let's communicate. I'll give you all the studies. I'll give you my information. But if you're coming to me for a specific reason, this is what I do. Just like, it'd be like me going to the cardiologist and saying, oh, I mismanaged this heart catheterization. I'm not going to tell them that because I don't know that, so they shouldn't do that either. But unfortunately, a lot of clinicians just don't want to give that up. I mean, again, I don't know if it's, politics, if it's ego, whatever. But unfortunately, I'm starting to see that more. And I know a lot of my colleagues have seen that a lot. So it's something that has to be dealt with gently because, you don't want to ruffle any feathers or make anybody mad and vice versa. So, but it's an issue for sure.
It's so hard too, because like, I have some clients that, before you and I started working together, they're like, hey, I trust you more than my doctor right now, because I was providing them studies. Like the biggest example would be people who came to me that said, well, my doctor said my estrogen's too high and I have to take Arimidex every other day. And I have all the studies that you have to show them why this is very dangerous in men, why men don't need to suppress estrogen. And it would be falling on deaf ears. And they would bring this literature to the doctor. They wouldn't read it because, again, you've lived that life where you're so busy. You're not going to go home and read the latest literature that's coming out on these type of topics when it's not your specialty, So
Yeah.
I get why they're not going to read it, but also maybe keep an open mind as to, well, hey, everything that was being said that is dangerous about testosterone obviously it's not a problem anymore. And men need estrogen. That can't be, we can't say it loud enough. And there's still, it's from the bodybuilding world. There's still a lot of people that think they have to suppress that. And their doctors just go off the paper because they flag it high on the labs.
I just did a post on Instagram, I think just the other day, I think on Monday, my Monday musings, and talk about, confirmation bias. And, I see that in the medical industry all the time where you learn something and you just can't unlearn it in your head. Whatever you learn first is stuck in your head. I learned that, testosterone causes heart attacks. And despite the fact there's been literally hundreds of studies proving that no, it does not. It's very safe. It actually benefits the heart. Like you said, a lot of doctors just can't get that out of their head or unlearn it. Well, this is just the way I've learned it, and that's just the way I'm going to do it. And I don't care what the new studies say. I don't know why they do that. We're all guilty of it. Look at the medical world, and my example with the video was like the whole thing on fats, right? Back in the 80s, it was like, oh, fats are bad. Fats are bad. Let's go low fat. And we learned finally, 20, 30 years later, we finally learned, oh, that we were wrong. Fats are good, the right fats, So sometimes it just takes time. I know there's a very well known physician, and actually he was a mutual friend of ours, Allie, that was very much on that. For example, you're talking about blocking estrogen for the longest time, and then he finally had a come to God moment. He realized that shit, I was wrong, and then he completely did a flip flop. And God love him, but so you got to have the willpower and the knowledge and the maturity to know when you don't, like you said, know what you don't know, and be willing to learn and to expand your horizon. I've been wrong many times, and I'm always learning. I'm always reading something because I don't know everything, and nobody does. So, but unfortunately, a lot of people just don't have the time or the inclination to kind of learn new things and admit that they are wrong. Nobody wants to admit that they are wrong about something, or that they don't know something, or that someone else knows something more or better than they do, like a certain someone we just talked about yesterday. So, a lot of people just don't want to let that go, and that's unfortunate. Because I think you and I, we're on the same page about things, and we just want the best for our patients and our clients. And hopefully, again, when that becomes an issue, it's sad because unfortunately, it's the patient and the client that suffers. So
yeah, and it was funny because this day or this week in 2017, I was in Chicago at the A4M conference, which is a medical conference that is very progressive. And for the fitness pros listening, I compare it to our Perform Better summits. And I basically gave a free seminar for whoever was on my Facebook feed because I was posting all the slides and all the information. And I was completely taken aback at how evolved it was. And I was like, why is every doctor not in this room right now? It is hard to get me to sit in a chair longer than an hour. I sat in my chair from 7:30 a.m. and they go till like 7:30 p.m. because they have all these meetings and stuff. And I was glued to my seat and my computer. And I would share and reshare some of these slides, and they're just talking about hormone deficiencies and actual hormones to take to help those deficiencies. They had like Terry Hertog from Belgium, and Ron something, I forget his name, about testosterone deficiency in men. And they were talking about the need for estrogen in men, you know, and 3 years ago, I think this has just come to fruition in the past few years. The fact like, yeah, can we stop blocking estrogen? And I was like, holy shit, like obviously the literature exists. We know it doesn't come to mainstream till like 30 years later, but the fact that it exists is very encouraging. And the fact that they're having seminars like that, granted they're doing a lot of the virtual stuff, and then the one in Vegas that hopefully we can all go to in December. But I was like, wow, so the education exists. It's just finding the time and the practitioners that go to these seminars that are the ones you want to align yourselves with. Is that like on the right track pretty much?
Absolutely. Absolutely. You want to find the ones that are always learning and doing new things and digging deeper. Hell, I just signed up for an online course about basic, you know, digging deep into chemical panels and things that I already know, but I want to dig even deeper as a doctor, as a clinician who's doing this advanced course and learning just things that heck I didn't even know. So you know, I just went to this course this last weekend. I've been to it before. It's my second time doing it. A lot of it was the same, but there's a lot of new pearls and tidbits which I'll be sharing over the next few weeks or so. But yeah, you want someone that is willing to admit that maybe they don't know something or they could know something better, whether it's your doctor or a trainer, your nutritionist, you know, and is always learning, always trying new things. That's what you want. You don't want someone who's kind of stuck in the mud doing the same old that they've been doing 20 years ago, because things change.
So what would your advice, because I tell people just fire your physician, find somebody else. Like I'm very in your face. Like, do you have a nicer way of you know,
Get lost.
yeah, like what can somebody say, you know, because obviously it's already terrifying for people sometimes to bring up hormone optimization because it's such an unknown, like taboo subject to the general population. So if they bring this up and obviously they're met with resistance or denial, what's the best way to kind of like, I guess, cheat on your doctor and
Well,
find someone else?
there's a few ways. One, I mean, I'm always a believer in honesty, right? Just tell them, say, look, I'm going to see this doctor for XYZ and I'm going to follow his instructions. I want you to take care of this, period. Don't worry about what he's doing over here. But if you want to collaborate, he's happy. That's the easiest thing. But if they're kind of I hate to say, if they're a douchebag about it, they're like, well, I don't think that blah, blah, blah. Well, then you tell them, well, thanks, but no thanks. And you find someone else. The third option is just to play a little game. This is what Dr. Ruzay always talks about. He says, you know, just don't tell them what you're taking. You know, if you're losing weight, you're feeling better. Hey, what are you doing? No, I'm just eating better, you know, whatever. Just don't tell them you're taking X hormone or doing this fasting protocol. Just leave it out. You don't have to lie, but just omit it or forget to mention it. And then the fourth one would be an even kind of a sneakier version of that is if you are taking something, you know, and you know, for example, they're going to check your blood, just stop taking it for a few days. And then when they check it, all your numbers are kind of shitty again. Then you start, that's nothing I would recommend doing, but he did mention that. So I'm probably saying that on live Instagram, but that's, I think either just be honest, find someone else, or just, you know, just kind of keep some things mum, you know, between us. So.
And then lastly, with insurance and everything, you know, everyone's always going to ask, how do I find someone that covers insurance? Can the labs be covered by insurance? Can the testosterone be covered by insurance? The answer is testosterone can be. It depends on the type of insurance. But what are reasons you don't want to go through insurance for things like hormone optimization?
Yeah, well, well, again, I probably shouldn't say this on live TV, but again, unfortunately, a lot of it comes down to politics and economics and other restrictions. Let's just say that the world insurance and big pharma, et cetera, they don't like what we do. They want their world run a certain way, and anything that doesn't fit in that little world, they don't like. So if they find a doctor ordering all these different unusual lab tests or a certain amount of hormones, they're going to try to find a way to screw them, basically, because they don't want that. They don't want the preventive. Unfortunately, they don't want. They want the sick care model to work and forget about the preventive side. So the more labs you order that are you're going to try to. You can bill things through insurance, but every time you do, they get a little flag. You get flagged,
Right.
flagged, and eventually you're going to get a ding. You're going to get a nasty letter in the mail, and then you're going to get something. They're going to try to do something to screw you over. I've seen it happen to a lot of my colleagues. So it's just not worth the hassle. You know, you can get things covered, but there's so many hoops to jump through for the client and the physician or the clinician. It's just not worth it. So for me, and most of my colleagues that do this, we just take it all cash. We don't mark anything up other than our time, our fee. So
Right.
the sneaky going on there is just that we just bill cash and we pay cash. And it just works much cleaner to leave insurance out, because all they're going to do is screw things up and make it hard for everyone and cause a lot of problems. And you're really not going to save much money really going through the insurance route. Like lab work, for example, is sometimes easy. It's a basic panel. I tell them, so like, well, we have a corporate account for our lab. You pay us, we pay them. Nothing changes. But if you want to submit it for reimbursement, go ahead. That's fine. But even that can be kind of a pain in the butt. So, but in general, it's better for the clients, better for me, and it's much faster, easier, or just to omit it. There's a lot of things I would love to say more about that, but I don't want to, have.
Yeah, no, but it's true. And I mean, I can tell you guys for a fact, like from a patient perspective, having done thousands of dollars worth of labs with every type of practitioner on this planet, I've done my homework the past 10 years. You can get the same panel that you would get through insurance for like $300, but when you add those special tests for $300 on an insurance-based panel, you will get a bill for $5,000. And they don't care. They literally don't care. And sometimes, you know what? It's not the doctor's fault. It's the phlebotomist who enters it from the requisition. And then if for some reason it's like, oh, extra tests. Oh, yeah, I don't know if they're covered, whatever. It's a game. They don't, the company doesn't tell you right away whether it's covered or not. They just decide when they send you a letter. You don't even want to mess with it. It's much better just to pay at most, I would say, the most expensive hormone panel I've seen is like $700. It depends on what you need, but for what you guys need for hormone optimization, it's going to be around $300-400. So it's really worth it, because otherwise it can be, like Eric said, it can be a nightmare. Yeah. And then we have one message from Todd, said family docs refer to specialists, and that's what the hormone doc ultimately is, except they have been selected by the patient. Yeah, that's very true, because quite often too, they don't know who to really refer to, because they don't know themselves, outside of states. Like I know Florida has a TRT clinic like every 5 feet, where they're sending you out the door with an arbitrary number of medications and whatever, because they just want, get in, get out, make their money. So yeah. It's interesting where everything goes based on who is funding the type of practice and medicine that the physicians are doing. So I think what you guys do is so phenomenal, because you can talk to the patient for as long as you want. You can dictate, what exactly the path will be, because there's no restrictions from any companies or, insurance-based things for you.
Yeah, it's kind of like how it used to be in the good old days. Marcus Welby, right? It was just a patient, and they figured out a plan. They worked together. It was great. And then before insurance and big pharma got involved, it kind of got all jacked up and messed up. And now now most doctors are like puppets on the string to the insurance industry and big pharma. And that's not how it was meant to be. All that hurts. It only helps them. It hurts the patient. It hurts the clinician. So this is more like that traditional model. I'm pretty inexpensive. A lot of my colleagues are more than I am. Some are less. But I mean, it's not expensive at all, really. And I always tell my patients, it's an investment in your health. How much is your health, your sanity, your libido, your over everything worth to you? To me, it's a lot. I mean, people that spend, $500 a month on junk supplements at GNC, I mean, they're going to pay less than that and get quality stuff from my. So it's like, to me, it's a no-brainer.
Yeah, and time is money too, because otherwise, how many people go through 7 or 8 doctors before they get to you and I, and right. It's like they're exhausted by that point. And so that is worth something, where you're going to pay up front. And most likely, I think testosterone replacement type of patients, maybe it's like $2,000 to $3,000 a year, which if you equate that to the time you spent going around to different doctors trying to get an answer, and the stress and the time away from family, it's totally worth it. Yep. And like you said, the recommendations you and I have, we recommend the same shit, even when we don't realize we recommend it. And it just shows that we're very much aligned, because you understand what I'm trying to do and I understand what you're trying to do, but we communicate. Communication, such a lost art these days. Like, it's crazy.
Communication is key, and we run it like a concierge practice, right? If you want to go the insurance traditional sick care model, try calling your doctor and say, hey, can I see you tomorrow? Hell no. And that's going to be for maybe you're lucky in a couple weeks, but they can, I mean, I reach out to my, you do too, our patients and clients. They'll email, text, or call, get back to them within, 10 minutes or an hour or something like that. So you get what you pay for. It's a whole different level of service. So
yeah, I mean, you and I are texting, what, it was 9 p.m. Friday night?
right, right. Hey, so
We have a life.
right.
Anyway, thank you guys for joining in. We shall see you next week for Testosterone Tuesday.
And next week, hit us up if you want to do a dual consult with us.
Yes, yes. Hit us up. Slide in the DMs.
All right. Thanks,
Have
guys.
a good night.
Bye.